Nigeria, women have always shown a high level of importance attached to pregnancy. They consider childbirth as an important part of their lives, a period most women look forward to. But in this excitement is the element of fear, due mainly to past experiences and lack of proper medical care.
Nearly everyone we met has had at least one sister or a wife or a mother that had died during delivery. So it was a familiar problem, a familiar issue to everyone.
Maternal and child mortality in the northeastern region of Nigeria, where Taraba State is situated, is very high, with an alarming maternal mortality ratio of 1,549 per 100,000 live births. Very few women attend antenatal services during pregnancy, and even fewer women deliver their children with the help of a skilled healthcare provider.
There is one woman who gave belly, and the woman don't know anything about clinic hospital. So this woman, she no go hospital, she no go test, she no go do anything. So this woman, they get the belly, her leg when they swell up, they do everything. She know they get better health. So at the end, this woman no come feel born. She on her labor day, the woman can't start to bleed. At the end, the woman can't die with 2 children inside belly. All of them die.
The Nigerian Demographic and Health Survey 2013 shows that only 23.4% of women in Taraba State gave birth in a health facility, and only 14.3% of deliveries were attended by a skilled provider. This shows that not only is attendance at health facilities low, but also exposure to skilled health providers is uncharacteristically even lower.
When I had pregnant, I used not to go hospital. I used to sit at home. Sometimes I would find medicine to take if I'm not well.
Several other factors responsible among these are the costs of the health services and attitude of service providers at the health centers.
What are we going to do, to address that? Address maternal mortality issues, So we designed a project where the owners, the agency to make a change, is actually vested in the community members themselves. The entire state of over 3 million had just 89 doctors and 506 qualified nurses. It's just astonishing to us. And then, the entire state depends on community health extension workers with questionable skill levels.
To address these issues, the African Radio Drama Association, ARDA, in partnership with Gamoon Center for Care and Development, received funding from the TY Danjuma Foundation to implement Community Health Matters CHM project.
The activities we carried out within the Community Health Matters project were numerous. We started with doing a lot of advocacy meetings with different stakeholders in the 4 project communities. That's Bali A, Sontai, Manya, and Chenchenji wards in Taraba State. And what we did was to seek their buy-in into the project for sustainability's sake, so that they own the project.
Basically, our involvement in the project was for advocacy, community mobilization, and monitoring. What we did was to make sure that we mobilized the communities for ARDA to work with, to engage with the project management committees, to engage with listeners club members, to engage with project monitoring committees, to engage with all stakeholders, men's groups, women's groups, in all the community areas that we worked, or in all the local government areas that we worked.
We try to create awareness to some of our women who will be coming out to our health center, so as to go round and immobilize other women who are always at home and they don't want to go to clinic. So I was part of the PIMA who are, in fact, telling the women to come out and go around and create awareness to the other women.
Another thing we did was to train community health extension workers, CHOOS, on interpersonal communication and counseling skills. And to do that, we produced an e-toolkit. That's we developed a toolkit that had all the information and skills on interpersonal communication and counseling. And we put this in a tab, so it's digital. It's on a tablet.
The toolkit is very wonderful because it helped me to diagnose the small condition of pregnant mothers, small children, malaria, and the rest of them. And I can be able to discuss with my client in verbal and non-verbal communications, and also I can be able to counsel my client in any direction that he comes. So it helped me a lot.
The toolkit helped me seriously because when I'm in confusion, I open to some sections and it enlightened me. It teaches me on what to do, on how to go straight about it.
CHOOS have the ability to reach communities that are often underserved by the healthcare services. Their mandate also includes home visits and community outreaches as opportunities for health education, counseling, and referral.
As a result of this learning or this program, so this helped me to boost my outreaches concerning RI, that is routine immunization. So as such, it helped me a lot. Then secondly, I was able to differentiate between counseling and advice, because I used to advise my patients instead of counseling. But now with the knowledge I got from this training, I was able to differentiate between the two.
To generate demand, for the services of CHOOS, for maternal and child health services, in fact, for general health-seeking behavior, for the community members, we did a radio program called Yarubaiwa. It was a radio drama that was aired on Ashi Waves FM and broadcasted in the project communities. It was very interactive and entertaining and interesting, so that people, we modeled behavior, in the radio drama, so that people could hear people who sound like them, and then learn skills, have increased knowledge and increased awareness on maternal and child health issues.
The setting up and facilitation of listeners' clubs by ARDA is an innovative way to spearhead positive action on maternal and child health in the project communities.
As I heard the program, I listened to radio and I attend the program. So the thing be say I can't enjoy the program. I get many things, and I get it's advisable for me to go and tell other people, and I did it. I went and tell my friends and my colleagues and other people at home that this program is a very good program. If you continue to be coming to the clinic or to the maternal antenatal, you will save your life and the child that is in your stomach.
A da ba mu sanin zuwa awo a asibiti ba, ko mace ta yi ciki tana zaune a gida, amma da mun fara jin wannan maganan yarbe wannan sai ya sa kowa ya yi samu abin na ciki. Mun samu basira, kuma inda da muke zama gidan an yi rashin lafiya ba san zuwa asibiti ba, yanzu duka mutane da yawa sun sani da zuwa asibiti. Ni karan kai na ma yanzu na ji dadin wannan program din, kaman kara ma sake a bar yin program din. Son samu da mun ci gaba da yin haka don mun ji dadi sosai. Irin rashin lafiya daban-daban da muke yi ma yanzu ba mu yi.
The thing will make me dey different with the person we know here. Me, I know now. I know past the person we know here and Gabadaya. Me where they hear the program, what they do. I know say now if I go buy medicine for clinic, for chemist, the thing no good. But the person we no hear this thing like can still go back and buy drug in the chemist. So that make me to be different from the person.
We used to move around to tell people what is hospital and what is the benefit of the hospital. When we do so, we used to get some people that they used to go for the hospital for checkup.
We found that the radio programs were very popular, and some of the characters were now names of characters were now being named after children born in the community.
As I was in this program, I get pregnant and I deliver. I name her Mercy Yarbewa because I like the program very well, and the program impart knowledge to my brain. That is why I named my pikin Mercy Yarbewa. This is the name of the group, Yarbewa.
There was an increase, definitely, into people going to health centers for pregnancy and child-related health matters. We found that CHOOS were very confident in doing their work and happier to counsel and show better interpersonal relations towards their clients.
There is one village that, in that village, there is those people, they don't want to attend clinics. Their husband, they don't allow them to go to clinic. But because of this program, one day we gather them and we give them, we help educate them, we tell them the importance of antenatal, importance of immunization. They started coming to our clinic, up to the extent that anytime they will call us to come and check them at home.
And as you can see now, we come for immunization and we have taken it. They have been trying. They even used to go about visiting us at our homes, taking care of the children. As you can see now, even the pregnant woman, they used to come and take injection here. And whenever people are sick, look at the clinic, they used to come for treatment, the clinic. So they have been trying very much.
Suna mana kan gaskiya ba wani bambanci a ciki. Duka suna taimaka mana gabaki ɗayan mu. Duk wanda ya kawo yaro ba sa ki. Suna mana rigakafi kuma yana mana amfani a jikin yara.
Although a successful project, it wasn't without challenges.
One of the challenges we faced was the conflict in the area. Fulani herdsmen and farmers, all those kind of crises, affected our program. Because many times we are not able to travel because there's a crisis going on and we had to postpone programs. Sometimes certain meetings cannot hold because of a crisis or a conflict, and we then had to postpone programs. To mitigate that, sometimes instead of going into the villages or into the communities, to carry out an activity, sometimes we bring people to Takum, which is more of a central and calmer place, for the activity to go on.
Chenchenji, Manya, and Sunte were communities that, from the research we conducted, were listening to the radio program in Ashiweb's Kasinala in Benue State. However, there were times that they could not, the signals could not get to these communities. So it was very difficult to hook onto the radio station.
There was no radio station. When we're doing our research, lots of names were thrown around, but when it was actually time to implement the program, we went to all these radio stations. Sometimes you hear, oh, this one burnt down, or this one is no longer functional. And as a result, we had to put the program in a radio station in the neighboring states. That's Ashi Waves FM in Benue State.
To address the problem in the health facilities and ensure effective planning, it is important for policymakers to have accurate and up-to-date information about the situation on ground and the need of each location. ARDA has been able to solve this key challenge from the training given to the CHOOS on information and data gathering.
I go through the information which is inside the toolkit. So when I go through, I come back and tell even my staff that this is how to advise somebody on what is disturbing him. So through this, I ask them, when a person comes to my clinic, I've told him what to do. Then if it is something that I can refer, I refer them to modern health care because I'm not enough, my clinic is not enough to take some of the disease control.
The project has also recorded an increase in the number of CHUs with enhanced skills in interpersonal communication and counseling.
It has improved my attitudes towards my patients and clients, and because of the positive attitude towards my patients and clients, it has helped to improve patient flow to my clinic.
The project has also shown that there is an increase in the number of people desiring to be CHUs.
And talking with community leaders, ward heads, we found that they were impressed by just how much the program, the radio programs and the rest of the project, in fact, how those touched people in their communities, how it touched them as individuals, and how what they have been able to do since then, like, you know, in promoting maternal health in their communities.
The improvement in the program, it will weather the situation of our community, and then it will bring progress to my people in the community.
In the Ministry of Health, we always believe in sustainability of projects and programs, and we build them up into our plans. So hopefully the budgets will come from the facilities to the local government level and then to the state level, and they'll be included for sustainability purposes.